The kidneys extend from about the 12th thoracic vertebra to the 3rd lumbar vertebra, although the right kidney is positioned slightly lower. The medial border contains the hilum and the renal sinus or space, through which renal vessels and nerves are going to pass. For simplicity, I haven't shown the renal vessels and nerves in this image, as I want to emphasise this funnel-shaped renal pelvis within the renal sinus. The spaces around these structures would normally be filled with adipose tissue or fat. Here is the renal capsule and the renal cortex. Renal columns are these extensions of the cortex that divide the medulla into 6 to 10 renal conical pyramids, which come to a point at the renal papilla facing the renal sinus and nestled into a cup called the minor calyx. These converge to form the major calyx, which unite to form the funnel-like shaped renal pelvis you see here. The ureter is a continuation of the renal pelvis and drains urine down into the bladder. A knowledge of the blood supply to the kidney is very important when studying the kidney's histological architecture. It's unusual in comprising an arterial portal system. So let me just review on this image, well, at least the arterial circulation anyway, the blood supply. Each kidney is supplied by the renal artery, which arises from the aorta. Within the hilum, segmental arteries branch off and give rise to interlobar arteries, which run up between the renal pyramids towards the corticomedullary junction. As it does, it divides again to form arcuate arteries, which travel along the base of the pyramid. Remember, the apex of the pyramid here faces the renal sinus. Each arcuate artery gives off interlobular arteries, which then pass into the cortex, from which several afferent arterioles arise to each supply a glomerulus. You can't see these small vessels in this image. Not wanting to complicate this image, an efferent arteriole leaves the glomerulus to form peritubular capillaries. That means they wrap around the renal tubules to reabsorb water and solutes from the tubules. From here, they then flow into interlobular veins, arcuate veins, interlobar veins, and then into the renal vein. About 2% of renal blood flow arises from efferent arterioles deep in the cortex close to the medulla, and these form the vasa recta. These vessels collect solutes and water from the medullary portions of the tubules.